All right, hopefully everybody can hear me. I know it's 6 o'clock. We're going to give it about 5 minutes and then we'll get started. So please just stay tuned. We've had a couple more folks join, so we're just going to get started at 6:05. So if you are on the line, please just hang tight. All right, I think we can go ahead and get started. I just wanted to quickly introduce myself. My name is Kate Kelly. I'm with Waterville Consulting. and we work with Melrose Wakefield Healthcare, and are really excited to have everyone joining us tonight for this conversation. I'm going to go ahead and introduce Councillor Linehan. She's going to get us started and take it from there. But we really appreciate everyone tuning in, and thank you for your time.
Great, thank you, Kate. So good evening, everyone. Thank you so much for joining us tonight. As Kate said, my name's Amanda Linehan. I'm here from the Malden City Council, and I'm so pleased to be joined by my counterpart on the school committee representing Ward 3, Jennifer Spadafora, as your co-host this evening. Before we get started, I do want to let folks know that this webinar is going to be recorded. So both to just share that so folks are aware, and also so if you join late or if you have a friend who couldn't make it, we are going to be posting that later. You can check out my Facebook page. Just search for Amanda Linehan, Ward 3, or it's Amanda for Malden on Facebook. So tonight's discussion, just to frame things, is going to be about COVID-19 and the impact that COVID's having on the mental health of our community. It's challenged us in ways big and small, and whether it's unemployment or housing insecurity, isolation or anxiety over the health of loved ones, none of us have ever experienced anything like what we've been through the last 3 months in our lifetimes. And so we felt it was important that we understand what resources exist to help us get through this. As parents and caregivers ourselves, as well as elected officials, Jennifer and I are both hearing from community members and constituents who are dealing with these challenges. And in some cases, we're dealing with many of the same challenges ourselves. So it was important for us to provide a forum for the community to come together, to ask questions of experts who are working in this space, and also to find and share resources to help all of you navigate these difficult times. Tonight, we're joined by 2 excellent clinicians, and you'll have an opportunity to hear from them shortly. But before we do that, and what I hope is a very lively and helpful discussion, I'd like to hand it over to Ms. Spadafora to offer some quick introductory remarks, and then I'll introduce our 2 speakers.
Thank you, Councillor Linehan. I think when you originally reached out in regards to this forum, I probably responded within 2 to 3 minutes, because just hearing about it, I was like, this is what we need in the city. And specifically coming from a school standpoint, you know, we're hearing a lot from parents that are overwhelmed with numerous issues, whether it's the remote learning, whether it's students that have been secluded from their peers for 3+ months. So I was happy to co-host this and make sure that people felt as though they could get answers to their questions, or just have a place where they can pose those questions. Might not always have the answers, but it's really helpful when we can actually speak out, ask questions, and have our voices heard. So I was really, really excited, and especially as a parent myself, going through, and I'm sure you can relate to that, Councillor, being at home, being secluded, not knowing. We have children that are dealing with anxieties themselves. I, for one, am really appreciative of the physicians that are taking their time out to be there and help us along during something that none of us have ever experienced. So, and with my background on school committee, I also sit on our subcommittee, which is the social, emotional, and physical well-being subcommittee. So I think these are conversations that, you know, we're going to be having in the future. This isn't necessarily something that's just going to go away. So I'm very thankful that we're having these discussions, and thank you for having me tonight.
Thank you. It's always a pleasure to serve with you, but I would echo a lot of what you said. As a parent, I'm seeing a lot of these issues, and also just hearing from a lot of my peers, a lot of my daughter's friends, parents, and, you know, I think when you're in a public office, people come to you with all manner of questions and anxieties, and I know we can't always solve everything for everyone, but it does feel great when we're able to point people towards some resources that can help. And on that note, I do want to thank quickly Melrose Wakefield for partnering with us to host this event, and just take a quick moment to recognize the work that they've done caring for the greater Malden community during the pandemic. knowing that we're not out of the woods yet on COVID-19, it's even more meaningful to me that they're here to help us and that it's a priority for them to help address, the mental health needs of families, caregivers, and all Malden community members in this time of deep need. So thank you for what you had to say, and I appreciate you being here so much. And with that, I'm going to briefly introduce our two clinicians who are joining us tonight, Dr. Kathryn Zioto and Meghan Dowd Murray. So Kathryn Zioto, just by way of a quick bio, is an adult psychiatrist and medical director at Tufts Medical Community Care Community Counseling Services. Prior to her work there, she worked as an adult psychiatrist at Codman Square Health Center in Dorchester. She graduated from Harvard Longwood Psychiatry Residency Training Program with a focus in community psychiatry. And prior to her residency, she completed medical school at Tufts University School of Medicine. She's currently working with TMCCC to expand behavioral health services into primary care. Meghan Dowd Murray is a licensed independent clinical social worker with over 15 years of experience in the mental health field. She's been a psychotherapist with Melrose Wakefield Healthcare's community counseling services for 5 years, treating adults through both individual and group therapy. Previous to this, she worked in a community mental health care setting in Boston with adults living with severe and persistent mental illness. Meghan received her BA from Boston University and her master's in social work from Simmons College. They will each be sharing with us tonight on a high level a little bit about what they're hearing from patients and share some resources and information that they've found helpful during these uncertain times. After we hear from them, we will have a question and answer segment at the end of the discussion, and we'll be able to take questions from the audience. All questions will be kept anonymous, and we will do our best to respond to as many as we can. So thank you to those that were able to send questions in advance. If you do want to submit a question in real time to our panelists, please just send it via the chat function, which is located in the bottom of the Zoom screen. And this will go directly to all of our panelists and will also be kept anonymous as we answer them. So with that, I'm going to mute myself and hand it over to Ms. Dowd Murray and Dr. Zioto.
Thank you, Councillor, and thank you all for coming tonight. I really appreciate the opportunity to speak with you. My name is Kathryn Zioto, and as mentioned before, I work as an adult psychiatrist. I usually work out of the Medford office of community counseling, but right now, myself, I'm working from home as well. And so Councillor Linehan had asked me to share with you some of what I've been seeing in the office and hearing from my patients over the past few months. I think it's really important to share that because part of what's so difficult with COVID-19 is that we do all feel so alone and so isolated, and yet so many of the things that we're experiencing and that we're feeling are common themes. And so I think just hearing that does provide some support, knowing that we're sharing these experiences. I have to say that COVID-19 has been the most universal stressor that I've ever encountered during my career. It's very different as a psychiatrist to go through a full day of patients and to hear that everyone is dealing with pretty much the same issue and how it's impacting them. There are common themes that have impacted patients, and then there are themes that are definitely more prevalent depending on the age group of the patient that I'm working with. There's also been an evolution of the response over time. So I can speak a little bit to that, but there definitely has been a progression from initial kind of almost denial and fear to now some more sadness and grief, as well as ongoing uncertainty. So at the beginning of the pandemic, there was a real contrast between patients who felt very fearful of the possibility of a pandemic. Those were the first that started stockpiling items and kind of preparing. And then patients who actually felt angry, they felt like perhaps public health officials were overreacting and that the reaction was really hindering their ability to go about their lives. But as cases rose in Massachusetts and the risk became more real, there became a palpable level of fear for almost all of my patients. I think some of the fear was greatest in the frontline workers and especially healthcare workers who knew they were going into settings where there was exposure to COVID-19 and were really uncertain about how to keep themselves safe. For other people, the fear was just about how to go about your daily life, how to do your job, how to go to the grocery store, go to the pharmacy, whether people would continue to have access to medications or food. And then as the mortality count rose, people became most focused on their loved ones, and especially loved ones who maybe have pre-existing medical conditions or were more vulnerable due to their age. separation was a big issue, especially separation from family members that were either hospitalized or in nursing homes or long-term care facilities. And part of the extreme end of that separation was grief over the loss of loved ones, especially when family could not be present during a family member's death or a loved one's death, or could not mourn in a traditional way, such as a funeral, because of restrictions on social gatherings. The closure of schools was a big turning point for families. It pushed many already stressed family systems into another level of distress. Families were trying to rapidly transition not only to working from home, but also to suddenly playing the role of teacher. And I think this was particularly difficult for parents of children with extra needs who maybe were used to having a one-on-one support person in the classroom and different adaptations, and trying to navigate how to recreate something that maybe even seemed somewhat like that at home. And I think the racial justice and anti-racism movements also added another level of stress, whether it was for individuals whose own experience with racism were being amplified through media coverage and everything that was going on, or other people who were increasingly aware of their own racism as a result of implicit racial bias. Within family, there was a lot of tension in terms of wanting to support family members to go to protests, but also being concerned about their well-being, both in terms of potential violence and also COVID. And then financial stress was a pervasive theme because of layoffs and uncertainty about the economy in general. As social distancing became fully enacted, there was a decrease in the fear, and actually it was really loneliness that set in and sadness. I think as people started to feel safer, they could actually make space to acknowledge some of the sadness and loss that had been caused by the pandemic. And a lot of patients shared missing major milestones, things like weddings, baby showers, children's graduations, or meeting new grandchildren. And, you know, I think it was difficult because I could hear these stories time and time again, and yet I could know that so many people had a shared experience of this loss, and yet I think for many people they felt so alone and not being able to have something like a celebration for these things. There also arose a tension between younger generations in families and older generations, where the younger generation was very worried about their own behavior and how it would impact their older family members' relatives, and also wanted to be somewhat protective and restrictive of what their older family member was doing in order to keep them safe. And then older family members feeling a little bit frustrated that their self-determination was being undermined by their well-intentioned younger family members. And my older patients have brought up a lot of thoughts about their own mortality and uncertainty about what later chapters are going to look like in their life, and whether they'll ever experience a lack of social restriction, which they took for granted prior to COVID-19. So my work with patients over the past few months has largely been supporting them as they cope with both anxiety and grief. And a lot of the suggestions I give people are very fundamental. I talk a lot about trying to pick one reliable source of information. I'm often guiding people to go to the Massachusetts Department of Public Health or the CDC website, because I think they have updated factual information and there's not as much sensationalism as some of the other media sources. I also talk about minimizing media exposure and getting the news in the morning, you know, whatever that information source is, checking in once a day, getting the information you need and then turning it off, and trying to avoid having that check-in be right before bed where it may stir up new anxieties. I also talk a lot about maintaining contact with loved ones. It's nice tonight that we're having this Zoom call, but I'll confess I didn't even have Zoom prior to COVID-19. And so at the beginning, there was a lot of scrambling in terms of trying to support individuals and then have them support their family members, and connecting and really using technology to its fullest capacity in order to keep people feeling like they could be able to communicate with each other. And it also meant for some people who knew social connection was important for them, but maybe are too shy or hesitant to let other people know that they need that check-in or that support, really pushing them to take active roles in calling and checking in with their friends, because by them taking that step, both the friend that they would call or the family member and themselves would feel some level of social connection and support. We talk a lot about keeping routine, trying to keep things as normal as possible, even though that's quite a tall order, but trying to keep the routine throughout the day. And this obviously means very different things for people with school-age kids versus people perhaps that are older. And then just taking some time for oneself each day, whether it's 5 or 10 minutes just to get outside, take a drive, watch a favorite show, or use a mindfulness app. But more than anything, a lot of it is reflecting and listening with patients on how they've coped when they've had overwhelming situations in the past. Because usually allowing patients to reflect on the coping skills that they've used for themselves that have worked effectively previously is the best way to identify the skills that'll work in this situation as well. So those are just some initial reflections, and I look forward to the discussion later. Thank you so much for including me tonight.
Thank you.
Okay, I'll take over a little bit. I'm Megan. I am a LICSW with community counseling. I work with Dr. Zioto. I'm a psychotherapist, so I do individual and group therapy with our patient population, which is adult, but we certainly have been hearing a lot about family issues and parenting issues in particular. So Dr. Zioto kind of covered the what we've been seeing, and I think I'm going to talk, and she talked a little bit about what we've been how we've been trying to support people and what we've been offering. So I think I'm going to talk a little bit more about that, and maybe get into more specifics about parenting in particular and families. So as Dr. Zioto covered, we've been seeing a lot of fear and worry and anxiety. People are worried about their health. People are worried about school, their jobs, finances, all that stuff. And I think Dr. Zioto mentioned this, but I think this is really important. So I want to say it again, how COVID is one of those unique things that like every single person is being impacted by it, but it can be in very different ways, but it also can feel so lonely and isolating, even though we're all going through it. And I think that's a really unique thing. And the fact that we can't really reach out and physically connect with the people that are also going through it makes it feel even more isolating, I think. So anxiety is something that we're seeing a lot. One of the challenges of this pandemic has been, we've been, as Dr. Zioto said, we're like inundated with information and there's so many unknowns. And when we don't have reliable, accurate information to plan, that's when we get anxious, because we all feel fear, which we should. Like, there's a big pandemic happening out there. It's scary. We want to plan to help keep ourselves and our family safe, but we don't actually have a lot of the time. We don't have the info to like make concrete plans. Like, here's how we're gonna manage in the next, because we don't know what's gonna happen in the next few months, the next year. So that is basically what creates anxiety. So I say that to say, if people have been feeling anxious, that makes a lot of sense. That's a pretty normal reaction to a situation where we don't have a lot of reliable info available. So in addition to anxiety, we see a lot of symptoms that look like depression as well. So a lot of people might be experiencing trouble sleeping, a lot of worry, feeling isolated and disconnected, having very little interest, or just trouble concentrating, not feeling motivated, not wanting to do the things that they usually did. And I'm going to talk later about kind of the line between what's typical response to COVID and stress, and then what is really more clinical depression. So I'll get into that. But I just kind of wanted to touch on that. That's a lot of what we're seeing as well. So if you're experiencing that stuff too, that's pretty typical. Some people might also notice that they're having emotions triggered through this that are related to past trauma. And that also is not uncommon. I've heard someone refer to that as dual trauma. And what that means is we're all kind of collectively experiencing this trauma of this pandemic. It is a traumatic event that we're all really going through together. And that can bring up the helplessness and powerlessness that we're feeling right now, can bring up emotions that are related to past trauma. So that's not unexpected in these circumstances, but I do want people to know that if that's happening for you, that it really could be important for you to get connected with treaters who provide good trauma-informed care. And we'll talk more about resources, I think, later. So Dr. Zioto talked a lot about some of the coping strategies, connecting with people, getting enough rest, eating well, exercising, trying to maintain a schedule, using coping skills that have worked for you in the past, trying to take advantage of maybe the time that you have with the people that are around you. So really trying to connect with the people that are available to you. And one of the things we're also trying to encourage people to do is to avoid the more negative coping strategies that aren't that helpful, like drinking more, using substances, withdrawing from activities or friends, not taking care of yourself, not eating well, not sleeping enough. Some of the basics are actually the most important things that you can do right now, really, in terms of self-care. In addition to kind of those self-care practices, one of the things that I've really been trying to encourage people to do is to as a lot of us have more time at home now, is developing a mindfulness practice, and that can include both formal mindfulness and informal mindfulness, and that can be really helpful. So really briefly, mindfulness is just being aware in the present moment with non-judgmental awareness. So you can develop a formal practice through meditating, or you can just have an informal practice of trying to be more present in the daily, in your day-to-day moments. But overall, a mindfulness practice can be really helpful in just getting through difficult times with a little bit more ease and kindness and compassion for yourself. So there's a lot of resources out there for that. There's a ton right now. I'm sure people have seen them. And we're going to have some, I think, available too on some of the slides that we have. Okay, so that's kind of self-care stuff and I wanted to now talk a little bit about kids and parents. I know that some of the questions that we got were regarding kids, so I'm not sure if some of what I say is going to answer those questions, and if not, we'll get to that. But I'm a parent and Dr. Zioto is a parent, so we're also going through this with kids at home and trying to manage. So one of the things I tell parents is we're parenting in a time of crisis, so you're not crazy. This is a crazy situation. I've had to remind myself that a lot personally. A lot of the resources and supports that we had that supported us as parents, we don't have access to them right now, especially if your child has special medical or behavioral needs. So we're being asked to do something without all of the resources that we usually have. And so one of the things that I think is helpful to keep in mind is that right now, and in general, but especially right now, it's okay to be a good enough parent. That means no parent is perfect. Striving for perfection is just, it's not useful. Nobody's the perfect parent, right? But what might be more useful to us right now is just working to be good enough. And that means recognizing and accepting that there's going to be days where we're struggling, where our kids are struggling. There's going to be ruptures in our connection with our kids, and that those are opportunities for us to make repairs. They're opportunities for reconnection and growth. Being a good enough parent means just owning that you have imperfections and taking responsibility for them and making repairs with your kids. And that's also modeling to your kids, like how to deal with emotions and how to get through difficult emotional times. Some parents have probably heard this already, but I think it's important enough to say again, the oxygen mask metaphor. Put your own oxygen mask on first, meaning prioritize your self-care. You can't give to others if you have nothing left for yourself. You can't pour from an empty cup. So that can be something small, like just taking a few minutes for yourself in the morning to have your coffee, to sit, prioritizing whatever is really important to you and makes you feel healthy and a little bit like yourself. So if that's exercise, that's talking on the phone with a friend or Zoom or whatever, but really making an effort to do those things that fill your cup so that you have something there for your kids. Because without that's what leads to burnout, and that's not good for anybody. So as far as dealing with kids and anxiety with COVID, if you have kids who are anxious about COVID, and probably most kids are a little bit worried about what's going on, or I should say kids like all of us are dealing with all the losses that have come with COVID. they lost school and connections and all those fun activities that they don't get to do. So I think the most important thing is having just an open dialogue. Ask them what they've heard, ask them if they have questions. Just because kids don't talk about it doesn't mean they're not thinking about it. And often if they don't have the answers, they can make up their own answers, which can lead to more anxiety. So it is helpful to just let them know you're here, you're open to discussing it. Answer them as best as you can, but with the underlying message that, like, no matter what, I'll be here for you. We're gonna take care of, your parents, your loved ones, your caregivers are gonna take care of you. It can be useful to help them connect with the silver linings, maybe, of what's going on. We're getting to spend more time together. You're getting to play more soccer, noticing the things that we're grateful for, the things that we have, checking in with gratitude. It doesn't have to be a formal discussion, but just checking in casually, in the car, during dinner, that sort of thing. One of the things that's these discussions can help is, again, like, help kids learn how to manage their own feelings and even get to know their feelings. So help them label their feelings. You sound sad, sounds like you're mad. Provide validation and allow them to feel what they're feeling. I think as parents, and I include myself in this, often you want to jump right in and save your kids from feeling pain and suffering and the sadness that is with all this loss. And our kids are learning now, I think. If they hadn't had experiences like this before, they're really learning that there is pain and disappointment in life. And this is an opportunity to allow them to be with their feelings. So not trying to make it go away or minimize it, but just allow them to express how they're feeling, be with them, be supportive and empathic, give them an opportunity to talk. That actually helps them to build resilience to deal with sadness and loss and pain in the future. We also encourage people with kids, same with adults, maintain a routine. Especially kids need physical activity, so as much as you can allow that in a safe way, please do. Kids also this is a great time to, and even with your kids, develop a mindfulness routine, as I've been talking about earlier. There's a ton of resources out there for kids too. All the ones that we noted or that we have in the slides all have mindfulness meditations or resources that are also for kids. And other relaxation techniques too, because it's a good time to help them just learn how to get in touch with their emotions, their body, how to manage that, how to take care of themselves. That can be through breathing, meditation, like a positive visualization, spending time with a pet, and sharing your own emotions too, letting them know you're having a hard day, that you're there, you guys, you need them and they need you. You're going to get through this together. So the last thing I kind of wanted to talk about was a typical response and then the warning signs. So this goes for both adults and kids. I want to be clear that stress is a normal response to this. This is a very stressful event. Feeling sad about what's happening is normal. Feeling a lot of sadness and grief over all these losses is normal. We've had a lot of loss and we're continuing to experience loss. So for both adults and kids, this is true. The warning signs that might indicate that you or your loved ones, your kids, might need a professional to speak to, or maybe more support than just what you have at home, is if the signs and the symptoms last for 2 or more weeks in a row. So, and make you or your kids really struggle, causing problems in your daily life. So the symptoms that I kind of talked about before: losing interest in the things you like to do, feeling sad. In kids, like really irritable, not interested in the things that they used to enjoy, not interested in playing the games they used to play, not wanting to eat, or changes in sleeping habits. And same for adults. If you're having a hard time getting through work, or maintaining connections, if you're struggling with like a lot of worry, a lot of rumination, or if your kids are excessively worried and your reassurance is not working for them. If all of this is getting in the way of you being able to, for you to kind of do your day-to-day life, and for your kids or loved ones, for them to do their typical life, that might be a sign that you need a little bit more help. And again, if it's an extended period, so like not lasting, like for every day for 2 weeks and really not changing. So a good place to start is with your primary care, or for your kids, your pediatrician. That's always a great place to start to speak about concerns, and they can really help kind of guide you in the right direction. And they can make a referral for mental health treatment, for individual therapy, group therapy. There are a lot of resources out there. Therapy is wonderful. And I just also want to say, feeling sad, feeling hopeless is typical in a crisis like this. But if you or someone you love is ever feeling like you don't want to live anymore, or you're thinking about harming yourselves, then that's a big warning sign that you need immediate help. That's not something that can wait. And I know we have the info for the emergency crisis team for Malden on one of our slides. So that's a really good resource if you feel like this is an emergency and needs immediate support.
I'm going to go ahead and actually put that up. That's a really good point. And I know we can recap a little bit about what we did talk about, but just making sure that everybody has some of this information to write down. And I know the counselor has a resource guide that she'll be posting as well, that recaps a lot of what we've discussed with some helpful information. And Counselor, I don't know if you wanted to add a little bit more, and Jen, please feel free to jump in too. I know we covered a lot, and then perhaps we can go ahead and open it up for some Q&A. But I want to make sure we have enough time for both of you to weigh back in.
Yeah, absolutely. That was fabulous. Thank you so much. And you took the words right out of my mouth in terms of just reiterating that we have that resource number. I'm glad that we have it ready to go on screen. And again, I will be sharing all of this on my website, social media. I'm sure, Jen can do the same, but I definitely want to take some questions, but I also wanted to sort of pause and reflect and just, give us a moment to digest. That was a lot of really important information, and I found a lot of it very relevant, very recognizable to some of the struggles going on in my house, and also just to some of the issues that parents and caregivers have shared with me since we announced this event. I do feel like, folks are struggling with definitely financial and housing issues, or food access issues, but also just knowing when an emotional reaction is kind of within the realm of what everybody's coping with and what signifies maybe needing to go get some extra help. I know a lot of the questions that I got from other parents had to do with kids having almost like regressing into younger behavior, like tantruming or potty accidents, or I will share my daughter is 6. She seems to be struggling with just crying a lot. Things that wouldn't have phased her just 4 or 5 months ago are bringing on the waterworks, and we really are struggling with like what's a normal COVID response and what is something that we need to help her kind of work through. And so I definitely want to give Jen a chance to touch on some of the things that she's hearing from constituents, but for me, those were just a few of the things that resonated. And I'd love if we could circle back and talk to some of those things that parents are worried about, like what's kid anxiety that seems normal, and at what point, should you try to get your child either some extra help, or are there things parents can do to deal with, again, these kind of what people kept calling these regression behaviors, like acting a little bit younger or acting in an emotional stage that doesn't match up with their age, during normal times. It seems like things are just a little bit off. So I'll hand it over to Jen to see if there's stuff she wanted to ask, but that was kind of what I was thinking.
Well, thank you, Counselor. That I'm hearing the same exact things. I'm also hearing, so as a special needs parent myself, so having a lot of conversations with fellow special needs parents, I think the stressors in parenting is, again, we're already special needs parents. So there's a whole nother gamut of what we're working with. And then now we have our children home 24/7. And I am by no means a speech therapist, occupational therapists, a physical therapist, but we're now playing those roles on top of the added triggers. So, you know, I'm hearing a lot from my special needs parents of, when do I get a break for myself? It's really tough because in what I'd call the normal world, something that we haven't seen in 4 months, we may be able to rely on family members that have come into the house and allowed us to maybe go grocery shopping, or maybe we even had personal care assistants that came in and worked with us, and that's something that we're unable to do right now. So we're really running the household and that parenting all in one, and trying to guide our kids and reassure them that it's going to be okay, but finding it difficult to find time for ourselves to really regroup at the end of the day. So I think if those parents that are out there listening, if we can talk to just, or reassuring that even 5 minutes is better than anything. I will be one to say that I have locked myself in the bathroom to take a breather. I find myself waking up a half hour earlier in the morning just so I can have that 30 minutes of alone time to have a cup of coffee. I actually try not to put on the news. I'll actually put on like a show that I've been meaning to watch and try to get 30 minutes of just me time before I tackle the normal chores of the day of folding laundry and cooking and then remote working and playing teacher and therapist. So, but that's one thing I've been hearing from my special needs parents are this is a 24-hour job. When do we get a little bit of time, and what can we do to focus on ourselves and make sure that we are taking care of ourselves? And again, to that analogy about the oxygen mask, to be a good parent, you know, you really have to focus on yourself for a moment first, and then we can focus on being really good parents for our children. So I think that's a hot topic in the special needs community right now. So I'd like to, if we have time, to touch upon that. And I don't know if we received any questions from special needs parents, but I think that would be worth touching upon for a bit. So thank you.
We did receive a few questions, but I'd love to give both of the clinicians a chance to kind of respond to what Jen and I had said before we take some of the questions that came in ahead of time. I'm impressed with your ability to be vulnerable and just share a lot of that's personal too, in addition to what constituents are telling you. I find that, you know, myself, especially being brand new, it's been frankly overwhelming trying to take care for my family and then take on all the needs of these very high risk, vulnerable community members too. And so, you know, just for all that you're doing for the parents that come to you, I know parents put a lot of trust in you and that you're taking a lot of those questions all the time. I see it happening on Facebook, and I'm sure a lot more happens behind the scenes. But do Kathryn and Meghan want to either take turns, jump in and react to any of the things that we brought up that we're hearing from our community? That would be great.
Sure. So first of all, yeah, thank you guys both for sharing and for disclosing a little bit too. And I think the first thing I want to say is that both of your concerns, they are themes that we're hearing. So I mean, I think you know that. It sounds like, Jennifer, you're doing a great job connecting with other parents, and so you have an awareness that you're not alone in that feeling. But you know, we've been hearing that as well. I think I can speak to the regression piece. So yes, regression is very common in a situation like this, right? So when times are good and there's not an extra stressor, we think of kids regressing either because they're preparing to learn a new skill or because they're kind of consolidating on gains that have already been made. But we also think of regression as happening during times of stress. And I think that in this situation, when we're seeing kids regress, you know, in the context of all of the stress with COVID-19, really trying to acknowledge that. Now, I don't know exactly the age of, you know, particular children, but using age appropriate language to make an observation that, you know, I notice you're more tearful lately, and I'm wondering if you're just feeling overwhelmed. And then actually really providing the kid with the opportunity to be regressed. So even if it's like having more cuddle time, sitting with the kid and maybe one of their stuffed animals, and even looking at a baby picture and saying like, look how little you were, and look at all the changes you've made, and remember when you couldn't do X, Y, and Z, and now you can, and I'm so proud of you. And but yet still kind of participating in that regression, and giving yourself permission, knowing that it's a temporary thing and that they will move forward, because for kids, it's more rewarding to make gains than it is to stay in a regressed state. I think that that's some of the best things that you can do, and also just acknowledging that actually by allowing it to happen, you are also providing a service that, it's some comfort in a situation where things do seem so out of control.
I'm just going to add to that. I think it can be helpful to frame kids' regression or just to see it as they're showing stress. Like we, adults can speak and older kids can say, I'm feeling really overwhelmed. I'm feeling really stressed. This is hard. I'm so sad that I can't go outside and do the things I usually do, blah, blah, blah. And kids can't articulate their emotions in that way, so they show their feelings with behavior. So like basically what Dr. Zioto said is really, I think, useful, best way to respond, not to shame them or blame them for what really is like a pretty appropriate way to express how they're feeling. And I know that knowing that, framing it that way doesn't make it any easier, maybe. But sometimes it can be helpful to be able to take a step back and go, this is them just showing me how hard this is. And it is really hard. There's no doubt about it. And yeah. So.
Well, that was super helpful, just speaking personally, but I'm sure that the person who asked the question, I don't know if they're on, we're trying to be very careful about keeping it anonymous. But it definitely touched on a theme. I heard it in a lot of different ways. And another thing I just wanted to follow up on is a lot of parents would share things like that with me and then relate it back to things like preschool or kindergarten readiness. And if kids are on the cusp of making, a change in the school that they're going to be going to, or there's a thought about whether they should go to kindergarten if they are struggling with like crying or potty issues, or even sleep issues is another one. I don't know if I mentioned, I heard that from people. Is there a way, or what tips would you give to parents and caregivers who are struggling with making that decision about what to do about whether to start school? Is the stuff that they're exhibiting now going to be something that they should take into consideration as to whether, a big transition is going to be problematic? Or how would you go about that? Or what advice would you give to someone who's kind of weighing that alongside the regression?
So one thing I think that might be helpful to keep in mind is like, so many people are dealing with this, right? So all the kids who were in whatever grade missed the end of their grade. Everybody's kind of going in this together. So sometimes I think we experience a lot of worry about our own particular child. And that doesn't mean to say kids that have special needs or kids that have special accommodations might be a little bit farther behind, but I think everybody's going to be kind of coming in a little bit farther behind and, really going to need more support probably. And I know that I can't remember who it was, if it was the city councilor or the school committee member who talked about the social emotional piece and how important that was. I think that is going to be so important for kids going back to school and making that transition. And yeah. I don't know if Dr. Zioto, you wanted to add anything to that?
Yeah, I think the only thing I'd add to is I think, again, using the pediatrician as a resource for those decisions, because they're going to be the one that knows the developmental trajectory of your kid. They also are having an entire patient panel right now that's all experiencing the same stressor. And so they can put into context somebody's child's emotional reaction and maybe how that compares with what else they're seeing. And then, additionally put that into their own expertise in terms of what they would usually make as a recommendation to a family. So I think the pediatrician is a great resource.
Mm-hmm.
That's a great point. It also reminds me that a few people had asked, sort of just kind of piggybacking on that transition piece, and the advice to engage with the pediatrician obviously is a great point, well taken. I am hearing from people, even though I'm not on the school committee, asking how can they decide how it's going to be safe to send kids back in the fall. I think everybody understands that it's, you know, an ever evolving public health situation, but I do get a lot of parents that have asked me, either in the context of this event or just in general, like, how do we make that decision? Or how do you know, if you don't feel safe, but the school is reopening? And it kind of relates to an additional question that I got a lot, which is like, what if all your friends are doing one thing and you're not comfortable with that? Like, I got a lot of people saying, well, people on my street are doing play dates again, and I just don't feel comfortable. How do you navigate those things without losing friendships or losing those connections? So I guess that's kind of a two-part related thing, but what would you say for kind of either of those considerations?
So, this is a very common issue, and I think it's coming up with our patients, but I'm also, happy to share that this is coming up in our lives as well. And I was actually commenting to Meghan before this panel that my own in-laws are planning something for 4th of July, and there was talk about people staying over in the same house. And, I made a decision that my family was not going to be doing that. And, it comes up in terms of how do we make our decisions and how do we own our decisions based on what works for our family. And I think what is so important is to understand that each person has a different equation that they're using when they're determining the level of risk that's acceptable for their family, right? And I think that because we're having to make these decisions, for our own family, but collectively with our kids' friends or, extended family members or other communities, whatever it may be, I think it's really important for us, instead of trying to judge other people's decisions and kind of critique maybe the evidence that surrounds their decisions and the actual risk or whatever, I think it's really important for us to just try to be empathic and really understand why it is that other people are making the decisions that they're making, and to come from a much more non-judgmental stance. Because I think that if we can do that and model that, then I think the hope would be that other people would do that for us as well. And, we really all do bring different factors into the equation, whether it's family members with vulnerable medical conditions or, our own level of anxiety and concern about germs in general. So I think like really trying to spread compassion and even modeling that with our own families in terms of if kids have questions of why is one family doing X and another family is doing Y and we're doing Z, and really trying to model that for them as well, that, that people are coming from different levels of worry and that people need to do what's right for their family and that we need to respect that as a family as well. So I don't think it totally solves the tension that comes up, but I think it's an important consideration.
I just will add to that. I think Dr. Zioto pretty much covered most of it. I just think one of the things that I think we notice when people are scared and acting from a place of fear is they often panic and go into fight or flight, and that can be yelling and screaming or pointing out you're standing too close to me or buying all the toilet paper on the shelf, and that's, again, having a stance of compassion, knowing that those actions are often coming just from fear and wanting to protect themselves and wanting to protect their families. And then for ourselves, being able to maybe take a minute and slow our system down, take a few breaths, and really evaluate the choices that we want to make. So from a place of not panic, right? We want to be acting from a place of calmerness. I won't say calmness, that's hard to achieve right now, but something a little calmer, and recognizing and making space for what I do for my family is the choices that I'm going to make, and that other people are going to make the choices that are best, as Dr. Zioto was saying, and being able to just allow and accept that. And that is uncomfortable. Acknowledging too that this is really uncomfortable. We're in a point, I think, where we are is wading right now in particular into an uncomfortable zone where people's feelings might not match up and their ideas about what's safe might not match up, and that there is space for everyone's opinions. We don't have to agree, but ultimately allowing ourselves and others to have the space to kind of make the choices that are best for us. And regarding returning to school, that's a really difficult decision. I mean, we still have 2 months until school starts, so maybe things will change or there will be more clarity, and maybe the school committee members can speak more to that. But I think from our perspective, Kathryn and I had talked about this, that really there's a risk reward kind of calculation that each family individually has to make for themselves, and that's hard.
And I think actually it almost brings me back, I think, Jennifer, to your initial question about like, how do you make time for self-care given the logistics of not just working from home, managing a household and managing children's needs, but especially when you have a child with special needs. And I think, first of all, I think it sounds like you're doing a fantastic job, to be honest. I think things like, sacrificing a half an hour of sleep because it may give you a half an hour of sanity because you get to have a coffee and watch a show that distracts you and is a positive distraction technique. I mean, that is really fantastic. And yet, you're having to sacrifice sleep to get that done. I mean, I think that, for people who co-parent, trying to take shifts where like somebody gets a half hour and then the other person gets a half hour, once a day or something, it's not much time, but I think that the extra effort to be the one on for that period of time pays off. I think that for people who are not co-parenting, and this is where I think that what Meghan was just speaking to kind of brought this up in my mind. I think that, again, it's all about this risk reward equation. So I think if a parent feels like they're at their breaking point where like they just need an hour to themselves, then I think it does weigh into the equation of, do I bring someone else into the mix? Whether I can find another friend who is also a parent where we could actually kind of open up our bubble so that we have still a small bubble, but we can kind of trade off, or, one family member and maybe have them trade off, something like that, where but yet it's all kind of weighing this, risk and reward. And I think the other thing I want to speak to is, I think, of course, we want consistency for our kids, but I also think the equation can change day to day, depending on how desperate we feel for support or companionship. And I think that's also okay, and so, of course, every time we make that risk, then that decision, we are exposing ourselves to some risk. But if we do something because we felt desperate to go to a barbecue and sit outside in a backyard, socially distanced, but maybe there's more people than we wanted, and then we reflect on it and we say, I needed that, but that might have been too much. That's okay too, because I think it's a work in progress.
I really appreciate you putting it that way, because I do think that's something I hear a lot is like, it used to be very black and white and now it's gray. There are certain things that are kind of up to me to decide, and people have almost lost the ability to make those in-between decisions. It feels very insecure, feeling like, well, the mayor or the governor was telling us all to do this one thing for so long, and I could get behind that because everybody was doing it. And now it's sort of like, this state's doing one thing and you may have relatives in another state. Like I heard from a lot of people who had either co-parents or grandparents or other people that they split caregiving with prior to COVID, saying, they're now having to factor in the New Hampshire or Rhode Island rules. And then on top of that, you've got neighbors doing all different things. And, some people are sending their kids back to daycare, some aren't. Some workplaces are reopening in different ways and others aren't. And it just makes it hard to be able to make that determination. It's not as cut and dried like it was for so long. And it's interesting because I felt like there was a very swift backlash to not having that freedom to decide at first. And then most people went into it and sort of gave up and said, okay, this is what the reality is going to be. We're all doing the same thing. And now coming back out of it, it's been interesting to see how hard that is for people. And I wanted to say also that we got a question in the Q&A actually. So I will just remind folks that the chat is the place to put stuff, but that's okay. We see the Q&A question, and it's kind of related to this. It's someone is asking, not so much for the kids side, but do you have advice for folks that are re-entering their physical workplace and contending with coworkers' stress responses as well as your own?
think it's similar. I think you kind of said it very succinctly. We're living in the gray now, where the black and white, the right and wrong answers are not as clear. So really, I don't know, maybe this is my therapist part, but I think this is a really great time for us to learn how to live in discomfort. We're all expanding our comfort zones about the conversations that we can have with our coworkers, about and being able to listen, maybe talk less and listen a little bit more. So just so that I think one of the it's going to be challenging and it's going to be hard, and even just naming that can be really helpful. And also, there's nothing you can do about your coworker's stress response. You can manage your own stress response, and you can learn how to manage that better. You know, this is a really stressful time. Our stress is actually not even the things that are happening to us. It's like our physical stress response when we get all tense and tight. So I actually would say, you know, turn the spotlight away from the coworker and probably more on yourself and how you can manage what comes up for you in these situations. And know that, you know, you're doing the best that you can. Have some patience and kindness for yourself and your response.
I think too, if people, you know, I don't want to assume what people's largest worries are, but I think, you know, as we're speaking about this gray zone and people using different practices, I think one of the big concerns is if someone's being more cautious and then they have a coworker that they feel is maybe not doing everything that is possible in order to minimize the risk of infection. I think even trying to kind of practice a way to say to people, you know, I'm going to put my mask on because I want to make sure I'm keeping you safe, or whatever it might be that could cue to another person, you know, maybe we should do this, or, you know, oh, I feel like I'm getting a little too close to it. I just want to make sure I'm being respectful. You know, it sounds like a little bit excessive to maybe like think about some of those one-liners, but I think having them kind of in your back pocket for when you return to work isn't the worst thing, because the situations are definitely going to come up. And if you've practiced that and you can be more comfortable in the moment, it's only going to help you to kind of make sure you're asserting your own needs.
That's very helpful. Thank you for that. I do want to pivot a little bit. We have a question in the chat that I'm going to summarize, because parts of it I think would have identifying information for the person asking, and we did say that we would anonymize everything. But the gist of it is that this person works as an educator, and they are very much have on their mind Black and brown families who are not able to deal with the impact of COVID alone, and wondering how they're doing. How are Black and brown parents in our community and their families coping with COVID? And given that so many of these families are speakers of other languages, is there any outreach for or to them? So that might be something that Jen could help answer a little bit from her perspective on the school committee. But I am interested in hearing what both Kathryn and Meghan might have to say about everything that's going on right now with Black Lives Matter and you know, just racism and episodes and incidents of racism in our community.
Thank you, Councillor. So, and I feel like I keep on pivoting to my own life. As a person of color, we're having these conversations in our household. My children are biracial. And I think for us, and I'm not going to speak for these educated clinicians that have more experience than I do, but just as a person of color, the dialogue is key. Opening up, having conversations. I happen to have one child that will see anything on Instagram or TikTok or whatever the social media outlets are, and come to me right away and say, "Mom, what do you think? Why is this happening?" And I might not have the answer, but I'm trying to direct them to the most accurate answers out there. So I know that when we go back to school, or when we're back in the classroom, I think the key for us is really going to be making sure that we have those guidance counselors there for these discussions, because this is not going away. And for us, we need to be extremely proactive. So I don't think I have much to offer other than open conversations and dialogue, and not, weaning away from it and pretending it's not there, because it's there, it's in our face. And we need to be open and communicating with our students, our Black and brown students. So with that being said, I'll hand it over to the experts though, but that's just my own opinion.
So we have a mixed population at community counseling. I would say actually probably our patient population has mostly white. I do have patients of color, patients that are Black and brown. But I will say, regardless of people's race, a lot of people are talking about what's going on. But obviously the people of color are experiencing it maybe in a different way. One of the things we deal with is trauma, a lot of trauma, and there's a lot of trauma associated with these issues. So on an individual level, when I'm working with people, we're really talking about what's getting brought up for them. And as a mental health practitioner, we're making our best effort to provide informed care, but I do think it's important to get people connected with the care that feels the best for them as well, and feels the most supportive and relevant. So that's also something that we do, is try and connect people with that. I can't really speak to the part about whether there's outreach to the Black and brown families in the community. I'm not sure if the city councillor or Jennifer could speak to that. But,
and I can just add that, I think in my patient population, so I do have a majority white patient panel. And I think one thing that's really coming up right now, and I think it's a good thing, is that a lot of my white patients are talking about increasing awareness of their own racism because of implicit racial bias. And I think, I shouldn't get too opinionated, but I think that's a wonderful thing. So people have come with shame and guilt and anxiety and discomfort about that. And so I think that, and an interesting dynamic is a lot of these folks are younger patients, I would say, and they are living within a family system right now, isolated because of COVID, where there are really different viewpoints within the family structure. And so there are a lot of conversations that are being had within those families, within those white families. And so, I think, kind of going back to what you were talking about, Jennifer, with keeping the conversation going, I guess my hope is that, as maybe people are less restricted from their bubbles, that conversation extends beyond those families. I think that, I agree with Megan. I can't speak in terms of language outreach. I'll defer to you guys on that. And I think in terms of, I know in this question talked a little bit about grief and dealing with grief depending on people's background. And I think, I think that when I think of grief, I think about more of a cultural context. And, I think identifying whether it's a religious leader or someone that can help the family process grief in in an adapted way that would be most approximate to what their normal cultural process would be. I think that's probably the best way to go there, but I can't say that we have expertise in that domain.
Yeah, I think I do want to kind of refer it back to Jen just quickly about what outreach the schools specifically might be able to do. I know in the context of the council, when we've spoken to the superintendent, when we've talked about some of these issues around the budget or around reopening decisions, this is obviously very top of mind. And I've been, as a parent in the public schools, fairly impressed with the cultural competency of the communications. It's improved quite a bit over the years that we've been here from what I've observed. I'm not a person of color, and my family is not linguistically isolated in any way. So I can't speak directly to how effective a lot of those outreach initiatives have been. I know that we're tracking it, and I know that we have a lot of work to do, but that we've also made a lot of improvement even just in the, 2 or 3 years that my child's been in the public schools, I've seen more in-person interpretation that makes me feel like it's getting better and better over time versus when we were new there, when everything was communicated in English only. Again, as a white woman, I can't possibly speak to these issues directly. I know some of the community members of color have shared with me that this really feels to them like a trauma on top of a trauma. That first we had COVID, and now we have a lot of these racial incidents happening, and people in the community who are white, who are confronting, as you just said, Dr. Zioto, their own racism or racism in their family, and then kind of putting that back on their friends of color to help them work through, and feeling like that's just an additional burden. And these are really hard conversations to be having in the community. And I know our schools are doing the best that they can. But this is a really difficult time. And I think as a person who's an elected official who's also white, I think the best thing I can do is really listen and step back and rely on, like you said, Dr. Zioto, some of the community groups that are working in these spaces. Like I know we have the Malden Neighbors Helping Neighbors group. They're doing a lot of mutual aid and direct help. And one of the key things that they're trying to do is elevate leaders of cultural groups or communities of color and really rely on them to not to be spokespeople for their communities, but to bring them in and to say, what can we do to provide services in a more culturally competent way? Or what are, right down to like food, what kind of food would be better for us to be sourcing to provide to the Chinese community that's not taking advantage of some of the food that's been made available? Well, if it's not the right kind of food, then it's not going to meet that need. And so that's just one example of how I've seen in real time some groups trying to pivot and just kind of say we don't know what we don't know, and we really have to look to the community leaders of color to educate, but also not rely on them to be the people who are educating all their white counterparts. And I think it's a really difficult balance. I'm hearing about that a lot from constituents wanting to learn, but also not wanting to say, hey, can my friends of color please tell me X, Y, and Z, because they know that is not appropriate either. But that was a lot more than I meant to say about that, Jen. I don't know if you have more to add that's a little bit more specific back to the schools or just how the community in general is kind of grappling with these issues.
I mean, I don't have a ton to add because we're not in the schools right now. And this is probably one of the most difficult things, is not having those key resources that we normally would have, the adjustment counselors and our social workers that are in the school that are, what I want to call ground zero, that would normally be speaking with our students when these questions arise. So it's difficult. I can say though, that the district has worked really hard when it comes to professional development for our teachers, when it comes to racial bias and understanding the student demographic. So my hope is that we can continue that, expand upon it, and make sure that when our students are back in the schools, that they're getting the services that essentially they're going to need when we come back from this. Again, you had mentioned how, COVID and, the I don't even know how to put it as a person of color. Sometimes I'm lost for words, but these racial issues that we're dealing with, it's not going to be easy when we go back through the doors of the schools. And one of the things that I really hope, and I know that the teachers in our schools are so amazing, and they're like front lines, the ones that hear everything. And from what I know and from what I experience, our professional development has been really focused on these issues. So I have a lot of trust in our teachers and our guidance counselors that they'll be there for our students, and hopefully we can really expand upon it more, even so, because it's these are questions that are going to continuously come up from our children.
Yeah, and I will also point out that in the resource guide that we've been compiling, we do have a lot of resources for, financial and housing help and mental health services, but we are compiling a list of links that we've been sourcing that can help families to have this conversation. And that is something that we're going to share when we follow up. So I think as a group, if we have other things that come to mind that we want to add to that list of resources, that can be kind of a living document too. I know I've tried to compile stuff on my page so that when parents or really any community member are looking for this wide range of help, that there's a place to point them. And this has been something I've had to very quickly adapt and add. And, we can, like I said, add that, share that afterwards, and then consider that a living document that we can share things as we hear about them. I do want to do a quick time check. It's 7:15. We have about 15 minutes, and we do have a few more questions that have come in, but I also want to pause and just, I know we have created some space for this very important topic that's come up, and just don't want to rush off of it either. So we do have time, plenty of time left, and I want to see if either of our clinicians have anything to add, to what Jennifer and I have had to say.
Just that if there's someone listening or on this call that is struggling and wants support, know that there are resources out there for them. There are resources that are specifically dealing with racial trauma. There are therapists who specifically work with racial trauma, and there's ways to find clinicians who are, if you want a person of color or if you want a woman, or there's a way to find a clinician that's a good fit for you, and that's a safe space where you feel like you can process your issues. So, please ask for help or look for help, or if you need it, there's resources out there.
If I may, one question that has been brought up is, we actually have a large population of students that already see psychiatrists, therapists, psychologists, and we've had to revert from in-person meetings to telehealth appointments, which is really difficult because to build a connection through Zoom or the telehealth system. So any pointers or suggestions on maybe how to continue these conversations with children's therapists, how to maybe have them open up a little bit more, any key points, making a list throughout, in between appointments on key factors that you're seeing, just to make the most out of these appointments while we're unable to be in the office with our clinicians right now.
I wish I had probably more to offer. I'm doing telehealth right now, and it's really difficult. There is a feeling of disconnection there. If you're just starting therapy, it can be hard to feel connected to someone over the screen. I think I have to say, honestly, because I don't treat kids, it's hard for me to speak specifically to pointers that might be helpful. I think in general, just owning and naming, what you're feeling, is really important, because that's just an opportunity to kind of to work through that, or to talk about what feels disconnecting, or what doesn't feel connecting. To have an open conversation with what works, and maybe that is something parents could do with the kids afterwards, is like, what felt good in that appointment, what didn't feel good, and assisting and providing feedback to the clinician so that they can know this is what kind of works for my kid. And parents in particular know their kids so well, they know they're the expert really, and so offering feedback might be useful. And I'm not sure, Jennifer, if you're speaking about the parent not getting as much out of the appointment, or the kid, or maybe both, maybe it's both. Yeah,
I think, a lot of times it takes some time for a child to open up to their therapist. So then once they get to that point, and now we've seen, regression, and that, okay, I'm not used to this screen time. I'm not used to maybe other family members in the household while I'm trying to have these really private conversations about my feelings.
Mhm.
So I think, as parents, maybe parents are able to adapt a little bit more to this experience, but our younger folks may not, when I say younger folks, our children may not know quite how to sit in front of a screen and actually
Yeah,
pour out
and a
those
lot of
feelings.
kids' therapy, as I'm sure you know, is play and in person, back and forth, and that's a really difficult thing to. I'm not sure if Dr. Zioto has some thoughts.
Yeah, I mean, I think that you're bringing up a really good point in terms of, I think there is a difference between children and adult when it comes to this domain. Even when I think about child therapy and how much play therapy can play into it, and just observing the child in the space and what they're doing and the nonverbal, I think there is a lot more of that in terms of working with children than with adults. Not all of which, but I would imagine a larger piece which is lost when you convert to telehealth. I do think one thing that may be helpful, and again, everyone knows their own kid best, but just as we're getting recommendations to kind of set up a classroom for our kid and have the space that's the designated learning space, an environment that kind of is for that, I think trying to create a space that could be used as like the doctor's appointment room or the therapist room. If, and do I expect that people have an extra room for this purpose? Of course not. But I mean, even if it's in the bedroom, that during that time, we're going to put a chair in a certain spot, and this is going to be your appointment with the doctor, so that they feel privacy, and that there's also some structure to it, maybe some cues that might make it feel like it's an appointment. I think that may help a little bit, but I think that it is difficult when normally a child would be doing a lot more than just sitting and talking face to face with a therapist, which is more of what we're doing with adults.
No, thank you for that. I think in these times, our kids are already under so much stress, so much anxiety. So, to add on to that. So I think having, like you said, that private space for them to really be able to be themselves and speak freely is important, and whether or not it's with their therapist, clinician, or even a parent, just making sure that they have that place where they're comfortable to freely express themselves is important.
I think you bring up a good point too, which is that when so little is in our control, even involving your kid and saying like, where do we want to set up your therapy appointment? Like, where do you feel most comfortable in the house? And what do you need to make it feel okay for you? I think there are small opportunities for the kid to have some control if they're at a stage where they could participate in.
Thank you all for that. That was really great. I do want to be mindful of the time. We have a little less than 10 minutes left, and we've gotten two final questions that I think are a little bit similar. So I'm going to kind of bring them together. So one question has to do with newcomers to the community, and it's, how can people create new connections and relationships right now as we approach this new normal? If you're a newcomer, what would your advice be for getting involved and joining the Malden community given the limitations that we have? And then the other piece to it that was kind of related is from someone who says they work with senior citizens and disabled residents who are struggling with staying in so much and not having social gatherings even in their own buildings that they live in. So kind of two related but slightly different points. I'm wondering if maybe we could close out by speaking to those two questions together.
So I think, so in terms of, creating new connections, I think that it really depends, I think, not only on a person's comfort and accessibility to technology, but also what a relationship looks like for them. I know a lot of my millennial patients, they're going on dates right now using, dating apps and then using Zoom, and it doesn't feel that strange. Whereas, I would think that for somebody who maybe has not had that be a part of their life experience until necessity, it may not feel as fulfilling to connect in that way. I think it all depends. But I do know in my own community that I do see people out, at this point doing things like group fitness that's socially distant, or bird watching socially distant, or, different community activities. And so I think there are things happening now, as long as people are, doing it in a way that feels safe. I think that in some ways it's the typical ways that people would find their own sense of community within a community, which is seeking out people who have similar interests. I think that when it comes to like religious gatherings, it's a little more complicated right now because things are smaller, but I do think there are things going on where people can get involved. Yeah.
This makes me so sad because I'm thinking of like the older people in the building. I see a lot of, I think Kathryn and I see a lot of elderly patients who live in like, public housing buildings that are really restrictive now about their community rooms and no visitors. And I totally understand the medical need behind that, but there's also such a huge loss there in socialization and connection. Lots of seniors who aren't having their like coffee club, and those things can be so meaningful. So I don't know. I wish we could have more opportunities for connection. I mean, as Kathryn said, I think things are starting to open up a little bit. Obviously, we've all been doing this Zoom virtual thing, and it offers a little bit, but like we really need that in person. I think it's a big part of our health and who we are. So I think the one thing I'm noticing is a little bit goes a long way. Like even when I go and see a friend, if we're social distancing, I leave feeling like so good and so refreshed. And so having even small opportunities, a lot of people are getting to know their neighbors now in a way that they didn't before because they're home so much. So, sitting out in the front yard and being able to talk to people, those are pretty small things that I think people can do to feel connected. And hopefully establish like lasting relationships.
I also think elderly patients or elderly individuals, they're expert on dealing with challenges because the more years that we're on this earth, the more challenges we face. And so I think really trying to provide those people with the opportunity to tell you and to share with you how they've coped with difficult life experiences in the past. They probably have their own skills already. And yes, usually getting social support in person is a key element, but they probably have other skills too. And so trying to work with them on how to use those skills now is really important.
So if I may, Councillor?
Yes, please do. Go ahead.
Just a suggestion for, our folks that have children that are maybe moving into the community, and it's extremely tough to not know when your child's going to go back to school, where you're dealing with school registration. How do I register? And this is, I think, a perfect time for us to take advantage of a lot of these social media community groups where you can connect with your neighbors, whether it's a group that is particular to a school that your child may be going to, a group that is particular to your neighborhood, or just in general a city group. I think it's really important, and I know I've spent quite a bit of time talking with my peers in regards to maybe remote learning and whatever we're all going through at the same time. So, integrating yourself into those community groups online, I think, is extremely helpful in a time where you might not be able to walk down the street and meet your neighbors. You're able to at least get a general idea of your neighborhood or those kids that are going to be going to school with your own children. So as much as I know my own elderly parents have screamed about social media and technology and how much it's changed the world, I think this is a perfect time where we can't be face to face with our neighbors, that we're able to actually get to know them online. So I suggest anybody that's moving into the community to, if they have that option and ability, to hop online and try to find a neighborhood chat group and get to know people in that manner.
That's a really good point. And I will offer myself as a resource there, because I'm thinking as you're talking that I often do actually hear from people that are pretty new to the community who, you know, for whatever reason have found me or my page, and they'll reach out and just say like, you know, I've only been here a year or 6 months, and I hear you're my council rep, and what do I do if I want to get involved? These are the things I'm interested in. I'm always happy to have a conversation. Obviously, we can't do coffee. You know, prior to COVID, I used to get coffee with people and tell them, you know, look, this is some of the things I did when I was new here to get connected. These are some of the groups I know of that are looking for volunteers, or, you know, just learn a little bit about what they're really interested in. And then I can kind of help plug them into those networks in the community now that I've been here long enough that I know most of what those things are. And I agree with you. There's a lot of really active parent pages online. We've got on Facebook, the Malden Young Families page, which is should probably be renamed, you know, like Families and Caregivers of Young Children. It's not, you don't have to be young to be in the group. If you did, I think I'd be straining the membership level. But I think that it's good to find those groups. And even if you feel like you might not quite meet the criteria yet, or somebody in there can tell you, you know, there's a group for people that are really into cycling, or someone that's into gardening, or you might want to go on Nextdoor and you can meet people that are actually more immediate to your neighborhood, or each school has a page, from what I can tell. There's lots of ways, and I would just say if you are watching this at any point and you want to reach out to me, I'm happy to help make those connections for you. I do notice that it's 7:30 on the dot, so I want to give our two clinicians a chance to wrap up. Or Jen, if you have anything else that you want to add just before we close. And I want to thank all of you so much for your time. I think this has been a really fruitful discussion. I'm so glad that we got questions from the community. I know we didn't get to every single one, but I think in checking back over the list, we touched on most of the themes that people had submitted questions about. So if you have anything that you want to follow up, I think any of us would be happy to, you know, answer anything and follow up, and we will share those resources like I mentioned. But with that, I think I'll just close out my time speaking, turn it over to our two clinicians, and once again, thank you, and just give you a final chance to close us out. Thanks again.
So I'll go first. I just want to say thank you for giving us the opportunity to be here. Thank you, Amanda and Jennifer. I guess the message that I'm hoping people take home is, if you're struggling, that's me too. All of us are. This is really hard, and not to look at yourself as failing. I often tell, like, particularly those parents, like the special needs kids, it's kind of a setup right now. You know, if you feel like you're failing, it's not because you're a failure. It's because you don't have the supports that you really need to be feeling like you're succeeding. So try and keep yourself healthy and your family healthy, and get through this, and ask for help if you need it. There's, can't recommend therapy enough. There's somebody out there who wants to listen and be a support to you. So.
And I just want to thank you for letting me participate as well. I think it's really wonderful that you guys find speaking about these issues important. I think it shows how much you value the members of your community, and so I appreciate it.
And this is Kate. If I can jump in, I just want to make sure we close out one more time with some of the information that we have talked about. And so I'm going to put up on the screen just one more time for any emergency support that anybody might need at any time. This is a number you can call 24 hours a day. And as the counselor did mention, we will have a full list of the resources that we discussed online. So if you didn't catch it in live time, I think we have been recorded, so this will be broadcasted later. And obviously everything lives online. So if you have questions, please don't hesitate to reach out. But really, thank you to the panelists. We really appreciate this. I know you guys have a lot going on with your normal lives. So we really do appreciate you taking the time to join us tonight and share all of your information. So thank you.
Thank you all so much.
All right. Have a wonderful night. Thank you, everybody. Stay safe.
Bye, everyone.